Okay, so for risk factors for patellofemoral pain syndrome, we have decreased quad strength as measured by isometric knee extensor strength. But note that this is not established in runners, so this may not apply to a running population. Decreased hip strength, including abduction, external rotation, and extension. However, this may be as a consequence of pain rather than a driving factor, so the causative relationship is not certain there. And lastly, the training errors, which would be sudden changes in load and volume and or intensity. Differential diagnoses, we're going to look at quad or patellar tendinopathy, Osgood-Schlatter's disease, Sinding-Larsen-Johansson syndrome, knee osteoarthritis, bursitis, or iliotibial band syndrome. Okay, so for quad and patellar tendinopathy, you're going to look towards your pain location again. So for patellar tendinopathy, the patellar tendon connects the patella to the tibia, so you'd expect pain localized to the inferior pole or bottom of the patella. Whereas for quad tendinopathy, the quad tendon or quadriceps tendon attaches the quad muscles to the top of the patella, so you'd expect pain localized to that area. And often this is related to movements requiring deep knee flexion, whereas the patellar tendon is typically more related to activities high-level tendon loaded, such as jumping and changing direction. And you notice that both may present pain with prolonged sitting, squatting, and stairs, which is similar to patellofemoral pain syndrome. So ultimately, very similar diagnoses. Okay, so we have Osgood-Schlatter's disease, which is another attraction apophysitis. So it's the patellar tendon pulling on the tibial tuberosity where the patellar tendon attaches onto the tibia. So again, you're looking in that particular pain location, pain focused over the tibial tubercle and distal patellar tendon. It tends to be younger men and women, 8 to 13 for females, 12 to 15 for men. And you can expect tenderness/swelling of the patellar tendon and enlargement of the tibial tuberosity, which will present as a firm mass in chronic conditions. So Sinding-Larsen-Johansson syndrome, or SLJS, here again, you're looking for the pain location. So activity-related pain focused over the lower pole or bottom of the patella and proximal patellar tendon. So this is another one of those tendon traction-related injuries where the patellar tendon is this time, rather than pulling on the tibial tuberosity, it's pulling on the patella itself. So that would be where you'd expect that pain location. Again, you expect younger age, 10 to 14, and then you may expect tenderness/swelling of the patella or of the patellar tendon. So knee osteoarthritis, which again, we waited until this point to get here, which is going to be an age-related changes of the cartilage or subchondral bone in the knee. So you'd expect unilateral or one-sided, insidious, which would be unknown causes, so there's no incident that's related to it. Unilateral insidious joint pain. You'd expect morning or inactivity stiffness, so the morning stiffness of less than 30 minutes ish. Short-lived inactivity stiffness, which would be called gelling in a lot of cases. Joint line tenderness, so tenderness around the joint where the femur and the tibia connect. Range of motion related pain, plus it may be limited, and you may expect crepitus, which is a crunching, cracking, grindy noises. And you can look for joint effusion or swelling, plus or minus deformity of the knee, which can be valgus or varus, which can be a knee caving in or out, depending on where those the age-related changes are occurring. And another deformity option would be osteophyte, which would be bone growth. Okay, so here we have prepatellar bursitis, which is the bursa behind the patellar tendon or the patella. So you'd expect local tenderness to palpation to the anterior joint line, but lateral to the patellar tendon, and that's the hallmark of this condition. You may have swelling, and note that if there's an infection of this bursa, which you would want to get medically treated urgently, you look for if it's red, hot, swollen, and constantly painful, and you're going to refer to the ER urgently for infection control. And lastly, we have iliotibial band syndrome. So we're going to look for pain localized to the lateral aspect or outside of the knee, which would be the distal iliotibial band or the end of the tibial band. And then you're expecting some activity-related pain, which is similar to the PFPS. Often activity that can progress in a typical tendon fashion, especially with hills or downstairs. And you may notice swelling in severe cases.